So welcome to this introductory do I want to become a dental hygienist presentation. I am the Dental Hygiene Program Director here at Mesa. We have our coursework at the Red Mountain campus, and then all our clinical work is done south of here, well I guess it would be south and east of here at Arizona School of Dentistry and Oral Health. So all our clinicals are done there. So the program, a little bit about the program, it started in 2005. So we're a relatively young program in the college. How many of you are really interested in dental hygiene? Okay, a nice number of you. How many of you are here really just to get the extra credit? Okay, that's great. Now, but we might have different reasons for being here, but we do have one thing in common, and that is that we all own a mouth. And so before I get into this, I have to make a public service announcement on the oral health of your mouth. The mouth is connected to the entire body. The mouth is the gateway to the rest of the body. Everything that you take in to keep yourself well sustained, living, growing, thriving, goes through the mouth. If it's full of crap, then all that crap is going into your system. There is a blood flow in your system, which you know, and the blood flow is not just all these other body parts. It actually nourishes the teeth as well. There's a tooth. There's the gum tissue that supports the tooth, almost like a little sweater. And in between the tooth and the sweater, there's a little space, like the collar of your shirt. And in that space, bacteria love it, because it's dark and moist and warm. And so if you're not in the habit of removing that bacteria, it becomes a playground. They set up communities and families and condominiums and neighborhoods, and they grow and they thrive, and they can wreak a lot of havoc to not only your oral environment, but they move through your circulatory system everywhere. You can inhale these bacteria into your lungs. You can swallow these bacteria into your gut. And they're nasty. They're nasty. So take care of your oral environment in the same way that you take care of yourself. So if you take a shower every day, I'm hoping that you brush your teeth every day. Okay? So a lot of people will just forget, oh, I don't have time for that. Oh, it's a precious commodity, precious commodity. 3 minutes twice a day, and then make sure you find something that works well in your hands to clean in between the teeth as well. So, the teeth are connected to the body, and there's so much science showing that if your oral environment is not well maintained, filled with bacteria, then the chance and the likelihood of you having systemic disease problems are high, because those bacteria get in and make a mess of other things. So that's my public service announcement. If you didn't get the toothpaste before you came in, I hope you're now motivated to get some. I don't want to see any toothpaste left on the table when I leave. All right, so now let's talk about dental hygiene. Is this the career for you? Now, some of you feel pretty confident that this is what you want to do, and that's terrific. And some of you maybe don't really know what you want to do, so this is really exploratory. So wherever you are, I hope that there's something there for you. So we're going to do this in a way of asking a lot of questions, because it's really about you to self-discover what it is that is most meaningful to you. So if you're considering dental hygiene, the question that you have to ask is, do you like the sciences? Do you actually more than like the sciences? You crave the sciences. You excel in the sciences. You love science. The reason why this is important is dental hygiene is a science-based curriculum. And you know that if there's an ology on the end of a word. It's a science or a study of. So here's some of the sciences in dental hygiene. There's radiology. That's the science of radiation. We take x-rays on people. We have to know that. There's periodontology. That's the science of the gums and the bones that are holding your teeth in place. There is pharmacology, the study of drugs and medications, because we use those in dentistry. There is, there's more, histology. Histology is the study of the cells. Okay? So we have to know that. We have to know embryology, the science of how the tooth formed in utero and how the tooth continues to form when we move into our secondary dentition. So those are some. I know there's a few that I've missed, but we're heavy in sciences. Oral pathology, I forgot oral pathology. Oral pathology is the science of diseases in the mouth, things like cancers and viruses and bacteria infections, lesions, growths, things like that. So science. Do you love science? I have do you like. No, you really gotta love them because there's so many of them. All right? Next thing is, do you work well with your hands? Now, I'm not talking about working well with your hands like holding a hammer or holding a baseball bat, because those are big muscles that are doing some big things. I'm talking about little things. Holding things like your pencil. Holding things like, do you like needleworks? Or putting together models and really delicate work with your hands. Because think of this is your environment. This is where you're going to be working. And you're going to be working with these in this. So you have to have a lot of fine motor ability. A lot of fine motor ability, really good eye-hand coordination. Because that's one skill set that you're going to use. Dental hygiene is unique, and there is a very strong academic aspect, which we just talked about, and then there's this mechanical aspect. So can you use your hands in a way that has the potential for really delicate movements? Now, we aren't going to do brain surgery, so it's not quite, or microvascular surgery, not quite that intense. But you will need to have a good ability to control your hands. At any point in this, please feel free to interrupt and ask questions. So I really do want to have some engagement. Do you like to work in small, dark, moist spaces? You know, we had a dental hygiene student who went through all the prereqs, waited on the wait list, came into our program, and then after the first couple weeks in clinic, she decided to withdraw. We always do an exit interview. Why are you withdrawing? She was academically, she was doing it. She goes, I didn't know I was going to have to touch spit. So you've got to know that your hands are going to go in here. Now we're wearing gloves today. When I was first introduced into dentistry, we didn't wear gloves. It was just wet fingers. Wet fingers in the hand or in the mouth, and just we worked through. Okay? So you have to be able to not only have fine motor movement, but use that fine motor in a small contained environment. So you have to have this ability of focused attention, focused awareness, to really hone in into that without losing track of the person who's there. So we're focused on this really closely, but we also have an awareness that we have a human being, the whole human being that we're paying attention to. So think about that. Do you like to pick at things? Now, I know, and I'm not talking about picking your nose necessarily, but I'm talking about like cleaning the crumbs out of a drawer. I'm talking about like squeezing zits, picking scabs, you know, just knitting around on things that just like, because that is the skill set you're going to have. We're going to take the instruments and we're going to be applying our finesse of our fingers, our coordination, our eye, our intelligence, and we're going to be delicately removing crustaceans from people's oral environment. So there are soft debris products, which is called oral biofilm, mushy, cottage cheesy, removing. If you're feeling queasy right now, just thinking about that, dental hygiene might not be for you. This is a good sign. So there's soft things. Now the soft biofilm is filled with bacteria, and that's the stuff that you're removing on your own with your toothbrush and this high-quality toothpaste. If that remains for a long period of time, it will absorb minerals from your saliva, and it turns hard. Now, the slang is called tartar, and toothpaste is tartar control and all that. But that's really not the word we use. I don't know where it came from. We use the word calculus, calcium crustaceans, essentially. So calculus. And so you will be removing those from people's oral environment because they can't do it themselves. So that's the service that you provide. You'll be doing a whole lot of other things too. Screening for blood pressure and other things. But you do need to like to pick. Yeah, you do need to like to pick. All right, are you detailed oriented? Okay, are you detail oriented? So when you sit down to be, when a patient sits down into your chair to be cared for by you, you have to look at everything. You have to look at their coloring. You have to look at how they walk into the room. You have to gauge their nervousness by their body language. You have to be skilled in interviewing. Like, they said this, but I'm hearing that maybe it's this. So you have to pay attention to the nuances of their words. You'll review their medical history and you'll try and decipher, what does this mean to the oral care I'm going to provide, or what does this mean to the state of their oral health? Their oral health is deteriorating. Is something in their is something in their medical history contributing to that? You'll be examining all the gum tissue, looking for color changes, texture changes, size changes. You'll be looking at the hard tissue of the teeth, seeing if they're formed correctly, seeing if there's any decay that's starting. You'll be probing. We're going to be measuring that. I mentioned earlier the little collar. We have gum tissue, we have the tooth, and in between we're going to use a small ruler, essentially, and we're going to be measuring around there. What we're doing is we're actually feeling into where the bone level is, where the gum height is. So lots of details, lots of details. Are you detail oriented? So I should create, next time I do this, I'm going to create a checklist. A yes and no, so that you can say, yes, I am, no, I'm not. So attention to detail. Do you like people? I mean, we're working really, really close to people. If you don't like people, not necessarily going to be good for you. So you have to really like people. You have to like people not only in the conversational sense, but you really want to be there for people. You want to be there for people. So, do you like people? You have to like people so much that you are willing to be this close to them for 8 hours a day. Because, thank you so much. Because dental hygiene, we are invading a person's personal space. Their heads are in our laps and we are embracing them with our care. So you have to be really comfortable being that close to people. If that freaks you out, again, might not be the profession for you. I mean, we're safe right here. This is really safe, but I just, took that away. Are you a good communicator? All right, on 3, we were all supposed to lift together. Poor patients on the other side, on the floor on that, because of lack of communication. So what does the communication look like in dental hygiene? There's you communicating with the patient. You're listening actively. You're responding to their need. They're going to express concerns, values. You are going to have a lot of knowledge. You keep all that knowledge to yourself. You only take out the knowledge bit that is most appropriate to that patient at that moment in that time. So you have to have a communication finesse. But the patient's not the only person you have to communicate with. You have to communicate with your dentist. You have to communicate, here's my patient, this is what I observed, this is what I've noticed, this is what my concerns are, this is what we've discussed. And then the dentist will do an examination, and the two of you will help create a treatment plan appropriate for that patient. You may have to communicate with other people outside of dentistry, other healthcare professionals. Patient has high blood pressure. That's a concern. We'll call their physician or their nurse practitioner, and we're going to ask, this is what so-and-so has. This is what I'm planning to do. Is there any concerns, risks? What? How can I manage that? So communicate with the patient, the doctor, the other medical professionals that you might need to confer with, your coworkers. So lots of places where communication is going to be really important. Do you like teaching? How many of you have been to, well, how many of you have been to the dentist or dental hygienist? All right, terrific. A few of you, those of you who did not raise your hand, the invitation is right here. Our dental hygiene students are always seeking patients, and if you do not have a dental home, we would like our dental hygiene program to be your dental home. This is one brochure. It's English and Spanish on the same thing. If you are interested, you're not quite sure, do I want to be a dental hygienist? What do they really do? Be a patient in our program and communicate with one of the current dental hygiene students. They are always looking for patients. So have a look at that. One of the things, so for those of you who have had a dental hygiene appointment, been to a dental office, had a dental hygiene appointment, have any of them ever given you instruction on how to brush your teeth? How to floss your teeth? How to do things? Okay, that's what I'm talking about. So we use our education, we use our care, skill, judgment, knowledge, and we help educate the patient. Because whose mouth is it? Yeah, it's theirs, it's yours. So we want the patient to own their mouth, and in owning something, it's important to know how to take care of it. So our education is about helping our patients take care of what they own. Okay? So the responsibility is to teach. We also go to schools and teach at schools, community centers, nursing homes. We do a lot of teaching outside of the clinical space as well. Heart of service. Do you have a passion to serve those, especially to serve those who are underserved? So a big part of our profession is to give back. So the adage we use is, to whom much is given, much is expected. So as you go through the dental hygiene program and you gain the skills and the knowledge to become a professional, an oral health care professional, then it's our responsibility to, in turn, share that gift with others. So you got to have your paid job, because we all have bills to pay. But you can plan a day a month where you can provide free care in some of the many service facilities that are in Maricopa. And so we invite, our students to participate in public health programs so that they can give back to the community. So you really have to be willing to, or have this desire to help and serve. Do you like research? Okay. Now, up until this point, I've talked an awful lot about the clinical practice of dental hygiene, where we have patients and we treat our patients, we care for our patients, and that's a huge part. But another part of dental hygiene, you complete an associate's degree, which is what I did, community college associate's degree, practiced for a number of years. Then I went back to get my bachelor's degree and then on to get my master's degree. And so when you get your advanced degrees outside of your associate's degree, you can move on beyond the profession as far as clinical, and you can go into dental hygiene research, oral health research. You can move into sales. You can move into education. Research, so there's an avenue of dental science that's research-based. The other aspect of research I want to talk about is that dental hygiene is an evidence-based profession, meaning it's not willy-nilly. What we do is based on current research as we know it. Now, I know you guys are all in the sciences right now, and so you know that what we knew about certain aspects of science, especially biological sciences, 5 or 10 years ago, gosh, that's almost obsolete. We know so much more. And so the same is true with oral health. What I was trained in the science realm, it's all obsolete. I don't teach my students that any longer because we're evidence-based. We keep up with the sciences. So it's truly a lifelong learning profession. You would have to continue to learn throughout your career. As a matter of fact, with your license requirement, you have to have, I think it's about, it averages to about 12 to 15, it's 54 hours of continuing education every 3 years. So whatever that math is. I'm in science, not math. 54 divided by 3, that's how many CEs you would need a year. All right, do you like tinkering with technology? Technology in dentistry is up and coming. So here's some examples of what we use. This is cone beam imaging. So it captures X-rays. I'll put that in quote. Captures X-rays, but it's a tube that goes around emitting radiation, but it captures everything. It captures depth, width, perspective, different layers. We can go from skin, through the skin, into the muscles, see the nerves, the vessels, and then get to the teeth. Amazing technology. We can rotate, we can look under, we can look around, we can find tumors and growths and things like that. This is a laser, and it's a fluorescent laser designed to detect cavities. And detect cavities early, so we can make really small fillings rather than really large ones. And then the last one is an intraoral camera where we can go and we can take images of your teeth, show them to you, use that for education. Now these are simple technologies. There's others in the realm of creating dental restorations, CAD/CAM. If you're great with computers and you like health sciences, CAD/CAM imaging in a dental lab would be a great avenue as well. All right. And then you gotta like teeth. I mean, you gotta, again, I need to change that. You gotta love teeth. You gotta love teeth. And you've gotta be okay with blood, spit, and gunk. And honestly, you know, the people, and I don't know if any of you are out there, but the people who don't really work to remove the crud between their teeth, when you as a dental hygienist remove it, everything looks and smells like bad fish. Everything. So you got to be okay with that. I'm just saying. This is when your service heart has to be really plump, because you are giving this service with the intention of raising up the health of another human being. So you got to really like that stuff. Spit and the blood. And I can't tell you how many times I've gotten gleeked on, not intentionally. My brother only did it intentionally, but my patient's like, oh, where'd that come from? Oof. Yeah, it happens. You were waiting. You were waiting. Yeah. Now this is not an exaggerated picture. I mean, there are people who have not had the privilege of being able to seek dental care, and so this is bacteria that has taken hold of their environment and then has started to eat away at their precious commodity. So this is where the service heart is maximized. We're here providing care, and then we have changed lives with what we've done. All right, how well do you take care of your own teeth? Dun, 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 dun. I'm not here to judge anybody. I'm here to motivate you. Motivate you. Yeah. What's really interesting is, okay, we got 10 fingers. We got 10 toes. And if something happened to those and we went to the doctor, we had an infection, and the doctor said, well, there is not anything we can do for you, so we're gonna have to amputate it. We're gonna have to amputate it. I would bet that there's not one of you in here that would say, oh, not worry, I got 9 more of them, so I can lose that one. No worries. Got it. But I would bet that if you went to a dentist because you had a tooth pain and they said, well, it's really infected, I can either fix it or pull it, I would bet that many of you would be inclined to say, yeah, I got 28 of them, or I got 32 of them. Yep, that's fine. Take it, just take it out. And dental pain is really uncomfortable, so pain can make us, pain can move us down a threshold of different decisions that we might not make if we were in pain. But the reason I'm telling you that is that a dental extraction is an amputation, but we don't think of it as such. So take care of them. Take care of them. Take care of them. There are some instances where removing the teeth is absolutely the best plan ever, because when the infection is so great that it's affecting the entire body, and so we want that infection removed, and that's the best plan ever. But if you can help it, if you have resources and choice, and then work to save your teeth in the same way that you'd work to save your fingers or your toes. All right. What do I have coming up? So just, dental hygiene. So how do you make the dream a reality if you're interested in doing this? So an associate's degree is the minimal requirement. So when you graduate Mesa Community College Dental Hygiene Program, you will end up with an associate's degree in applied science. That's the minimal requirement. But your journey does not end there, because what you would have to do, let's see, well, I guess I have a laser. What you would have to do is you have to pass a national dental hygiene exam. Okay? So it's very similar to what nurses have to do, pass their national exams. So you have to pass the national exam. Once you pass the national exam, you have to pass a regional clinical exam. So you have to do a test on a live patient. So you and your patient go into a testing area. You perform what it is you're supposed to perform. You're evaluated by evaluators. Forgot what they're called. And that's done anonymously, so they don't see examiners. You're evaluated by the examiners. They don't see you. You don't see them. And so you need to pass a live patient exam. Right? Check, 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 check. Now you've got those. Now you have to figure out where am I going, where do I want to practice? Where do I want to live, essentially? Because what you need then is you need to take wherever you're going to practice. Let's say you're going to practice in Arizona. Then you have to take the Arizona State Jurisprudence exam. So that's their law exam. So you have to know the laws, rules and regulations, statutes, laws of the state you're going to practice in. So you need to know, as a dental hygienist, what can I legally do? What can I legally do? So you have to pass that exam. Okay? So 1, 2, 3. Then you have to pay your license fee. In the state of Arizona, I just paid mine and I can't remember what it is. It's a 3-year license, and it's about $400 every 3 years. That's what your license is. So it's a privilege. And then you have to take classes every year to maintain your license. So that's the bare minimum. Now, if you never had ever an intention of practicing dental hygiene, you could get your associate's degree. Then you can move on to get your bachelor's degree in dental hygiene and public health and health innovation. ASU has some great transfer programs. NAU has the direct dental hygiene degree completion. Or you could move on, and I shouldn't say or, and then you could move on to get a master's degree, do research or something else. Okay? So this is only if you want to practice clinically. All right, so prerequisites first. So I'm going to bring your attention to these 2 handouts. Okay. Now, this glossy one, I want you to have both because this one is already a bit out of date. So if you open it up, there's a chemistry requirement that says Chem 138. We're no longer accepting Chem 138. Unless you, for those of you who are interested in dental hygiene and have been working on your prereqs and you've already done Chem 138, we're going to honor that. But if you haven't started any of them, we won't honor it. So, and we know who's started and declared dental hygiene. So you need both of these together. So these are the prereqs. There's about a little over 30 of them. So this would be 2 full-time semesters worth. Okay. There's some information about the program, ways to contact me and my support faculty, first and second year coordinator. So I made the changes up here. It's now Chem 130 and Math 112 or the 140 sequence. Okay? It's really important that you don't have to be a perfect student, but you have to be a really strong student because our GPA is that for all the sciences that you take, you have to have a 3.5 GPA. And for your overall GPA as a student, it has to be 3.25. So we won't look at your application if you don't have that. And then the other application requirement is that you have to have you have to either have worked in a dental office as a dental assistant or in some other capacity that has a dental hygienist on staff. So oral surgeons don't have a dental hygienist on staff usually. So it has to be somewhat where you can see the dental hygienist at work. 40 hours of observation or have worked in a dental office. And then that's basically the completed application. Then you're going to fill it out and you'll submit it in person on the Red Mountain campus to our academic advisor, Corky Palacios. P-A-L-A-C-I-O-S, and his name is Corky. He's the dedicated dental hygiene advisor. All right, so this is associate's degree, dental hygiene with a couple of changes in it. This is brand new, brand new, not advertised anywhere, and you are the first group of people to hear and see it. So we will be launching in the next probably 3 to 4 months a concurrent enrollment program with Northern Arizona University, which means that you can be taking NAU classes and your MCC dental hygiene classes all at the same time, and your prereqs is going to take you a year if you do it full time, and then all your dental hygiene courses, you can graduate with a master. What? You can graduate with a bachelor's degree in about 3.5 years if you do your prerequisites full time. Okay? Now, if you're a strong student, this is a path that you might want to look at, because you will achieve your bachelor's degree in a really condensed amount of time and at a very comfortable cost, because a large majority of your credits are community college credits at a fee that is more manageable than university credits. You will be dual degreed, so you'll have an AAS from Mesa Community College and you'll have a BS in dental hygiene from NAU. So this is a fantastic opportunity. So this is the sheet that you want to look at, because it's predicated, that timeline is predicated on these specific prerequisites. So if you take a look here, and we go down, let's just look at the math one, okay? So if you go in the middle column, it says math concepts and applications. That's the 112 or a higher level. College math 140, 141, 142 are required for the CEP. So if you want to go for the CEP, then you take 140 or one of the other ones. Okay? That's what's going to do it. And then the same is true in the humanities. To really condense that schedule, we gave you a specific NAU course for you to take. Is it an NAU course? No, not NAU course. A specific Maricopa course for you to take so that you can get the NAU requirements out of the way. Now, not to worry, if you don't take that, it'll just take you longer down the path. But if you are really a go-getter, this would be the path to follow. So this is going to go public in a few months. So I got permission to give it to you guys first. All right, I think, what do I have? The cost. How much is it going to cost? Community college. So whether you go to Mesa, Rio, or Phoenix, it's about $18,000, give or take. Okay? So $18,000. Once you're accepted in the program, it's a full-time program. It's a full-time program, 16 hours, 15 to 16 hours, a little bit more if you're doing CEP, so you got to be strong. If you decided to go to our for-profit school down the road, just to give you a comparison, yes, there's no wait list. Yes, you can do all your prereqs at the same time and blah, 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 but it costs you 3 times as much. 3 times as much for the exact same degree. Okay? So you got to think about that. So you have community service projects, you got study time and that. So it is a full-time job. So while we do have about 1/3 of our students have part-time jobs, the majority of our students don't work. They have financial aid or they've worked really hard prior to getting in, saved so they could pay for it. I don't really have time for this, to open this up, because I don't know if I'm connected to the internet. But I can forward the link to you. It's a summary of the dental hygiene profession with a cost analysis and projected growth. So dental hygiene is moving in a projected need. So until 2026, there's like a 20% increase in need. So that means it's viable. And it's a highly paid profession for an associate's degree. So it's, you can expect about $35 an hour as a new grad. Now, I just want to give you a warning. There are so many students who say, I'm doing that. All they hear is $35 an hour. You got to do a lot of work to get to that $35 an hour. So we want to set you up for success. So if all those questions I asked, if you don't feel comfortable with some of them, in particular the sciences or being with spit, blood, and gunk, then the $35, let go of that. There are other fine professions that you can make a good income. There's the money. There's that. Yeah. Okay, so there's where dental hygiene, this is a full-time dental hygienist with an associate's degree. This is growing in Arizona. This is the end of this 10-year cycle, so I have to update it. But we were at a 32% growth. Yeah. All right, there's our website. This is how you find us. Program and degrees. Search for dental hygiene by name, and that'll get you there.